Did you know your liver could be screaming for help and you'd never even notice until it's almost too late? Your liver is quietly working around the clock to keep you alive. It's your body's built-in detoxifier, your metabolic engine, and your biggest internal organ. But what happens when this powerhouse starts to fail? And what if the signs are so subtle that you don't even realize your liver is crying for help? Most of us don't think much about our liver until something goes wrong. But did you know that liver damage doesn't always come with a big warning sign? In fact, there are some pretty strange and unexpected signals your body sends when your liver is in trouble. What if I told you that persistent itching, bad breath, or even bruising easily could all be signs that your liver is struggling to keep up? These are symptoms that most of us ignore or blame on other things. But if your liver is starting to fail, ignoring these signs could lead to something serious, something life-threatening. In today's video, we're diving deep into the 12 weird signs of liver damage that most people miss. Some of them may surprise you, and others might make you rethink that "I'm just tired" feeling. But before we jump into these weird and fascinating symptoms, let me remind you that your liver is incredibly resilient. It can repair itself if you catch the damage early. And that's what this video is all about, giving you the tools to recognize the warning signs before it's too late. Because, let's be honest, none of us want to end up in a hospital bed being told that we should have paid attention to our body's whispers when it was asking for help. If you're noticing any of the signs we're about to discuss, it could be your liver's way of telling you that it's under attack. And trust me, liver damage doesn't just happen overnight. It can be caused by a range of things: poor diet, alcohol consumption, viral infections, or even certain medications. So, it's vital to listen to your body and act fast when you spot the early signs. Stick with me until the end of this video because we'll also talk about some simple lifestyle changes you can make to protect your liver and keep it functioning at its best. And hey, if you're serious about your health, make sure to hit that subscribe button below. We've got tons of helpful content coming up that you won't want to miss. Alright, let's get into it, the 12 strange signs your liver might be in danger. You won't believe some of the things your body does when this vital organ is struggling. Sign 1. Yellowing of skin and eyes, jaundice. Imagine waking up, looking in the mirror, and suddenly noticing your eyes turning yellow. This isn't just some weird lighting, it could be one of the first signs that your liver is crying out for help. You see, when your liver is healthy, it breaks down red blood cells properly. But when it's in trouble, your liver starts to struggle with this process. One byproduct of red blood cells is bilirubin, a yellow compound that your liver usually processes and eliminates from the body. But if your liver can't do its job properly, bilirubin starts to build up in your system, giving your skin and the whites of your eyes that yellowish tint. This condition is what we call jaundice. Jaundice is one of the clearest indicators that something is wrong with your liver, but it often sneaks up on you. Most people think, "Oh, maybe I'm just tired," or "it's just a skin issue," but don't ignore it. Now, you might be wondering, how serious is this? Well, jaundice can be an early warning sign of various liver conditions, ranging from hepatitis to cirrhosis, or even liver cancer. And what's scary is that many people don't even know their liver is struggling until it's too late. So if you see yellowing in your skin or eyes, it's your body's way of saying, "Hey, pay attention." But don't panic just yet, jaundice can be treated. The key is catching it early, and that starts with recognizing the symptoms. A quick visit to the doctor and a few tests can tell you exactly what's going on with your liver. If you or someone you know notices these symptoms, it's important to seek medical advice immediately. Your liver is an essential organ for detoxifying your body, and if it's not working right, it's a sign that your whole system is under pressure. You don't want to let that go unnoticed. Now, here's where things get interesting. Jaundice doesn't always show up in full force right away. In the early stages, it can be subtle. You might notice just a slight yellowing of the whites of your eyes. But even a hint of this could mean your liver is having trouble keeping up. So, what should you do if you start noticing these signs? The first step is to keep an eye on your skin and eyes regularly. If the yellowing doesn't go away after a few days, or it starts getting worse, go see a doctor and get your liver checked out. You can't just brush this off as a minor issue. Jaundice might seem like a strange symptom, but trust me, it's your body's way of waving a red flag. And by taking action early, you could potentially stop liver damage before it progresses to something more severe. Stay informed, listen to your body, and always take action when you notice these unusual signs. Your liver will thank you for it. Sign 2. Dark urine. Did you know that your urine could be giving you clues about your liver health? Most people don't think twice about it, but if you've noticed your urine is darker than usual, it could be a warning sign that something's up with your liver. Let me explain why. When your liver is working properly, it helps remove toxins and produce bile, which aids in digestion. But when the liver starts to struggle, it can't break down substances like it should. One result of this? Darker urine. Here's why. When your liver isn't doing its job, bilirubin, which is a yellowish pigment formed by the breakdown of red blood cells, can start to build up. Normally, bilirubin is processed by the liver and excreted in your bile. But if your liver is damaged, that bilirubin can leak into your bloodstream and be filtered by your kidneys instead, and that's where the dark urine comes from. Suddenly, what's normally a pale yellow color becomes dark amber, brown, or even cola-colored. Now, I know what you're thinking. Wait, my urine has been dark before. Does that mean my liver is in trouble? Well, not necessarily. There are other reasons for dark urine, like dehydration. If you're not drinking enough water, your urine will naturally become more concentrated and darker in color. But here's the key difference: if you rehydrate, the color should return to normal. If it doesn't, and especially if it's accompanied by other symptoms like yellowing of the skin or eyes, it could be a sign that your liver is under strain. It's important to listen to your body. Dark urine that doesn't go away might be one of the earliest signs of liver dysfunction, especially if it's paired with fatigue, nausea, or pain in your abdomen. These symptoms together could point to a bigger issue like hepatitis, cirrhosis, or even liver failure. But don't panic. If you've noticed your urine is darker and you think it might be related to your liver, the first step is simple: stay hydrated and keep an eye on any other changes in your body. And if it continues or you have other symptoms, don't hesitate to contact a healthcare professional. Remember, dark urine alone isn't always a reason to worry, but it is a sign that you should pay attention to what your body is telling you. It might just save your liver. So, next time you hit the bathroom, take a quick look. Sign 3. Persistent itching. You might think that itching is just a minor annoyance. Maybe you chalk it up to dry skin, allergies, or even the weather. But what if I told you that persistent itching could be a major red flag for something much more serious, like liver damage? The liver is one of the most hard-working organs in your body, responsible for filtering toxins, producing bile, and regulating essential bodily functions. But when your liver isn't functioning properly, it can trigger some pretty strange symptoms. And one of the most overlooked signs? Intense, unexplained itching that just won't go away. Now, I'm not talking about your average itch from mosquito bites or dry skin. I'm talking about relentless itching, the kind that drives you crazy. It can happen anywhere on your body, but more often than not, it shows up on your arms, legs, or palms, areas where you don't normally expect such severe discomfort. So, why does this happen? It all comes down to bile. When your liver is damaged or not working correctly, it can't effectively process and release bile into your digestive system. Instead, bile acids start to build up in your bloodstream. These bile acids are meant to help with digestion, but when they accumulate in your blood, they irritate your nerve endings, causing that unbearable itching sensation. The worst part? Scratching doesn't really help. The itching isn't skin deep, it's coming from within. And here's something you might not expect: itching caused by liver damage can strike before other, more noticeable symptoms like jaundice. So, if you're experiencing this kind of itching out of the blue and you just can't seem to find relief, don't ignore it. It might be your liver sending out an SOS. Let's break it down. How can you tell if this itching is related to liver issues? Persistent, it's not just here and there, it's constant, day after day. Deep, no matter how much you scratch, the itch feels like it's coming from beneath the skin. Localized, often affects areas like your arms, legs, and palms. No visible rash, you may have the urge to scratch, but there's no obvious rash or skin irritation. This type of itching isn't just a passing phase. In fact, if it's linked to liver damage, it can last for months or even years, severely affecting your quality of life. And the longer it goes untreated, the more damage your liver could be sustaining behind the scenes. As liver function deteriorates, this symptom only gets worse. In fact, itching is often associated with chronic liver conditions like cirrhosis, hepatitis, or cholestasis. So, what should you do if you're experiencing persistent itching? First, don't panic. But don't ignore it either. Consult your doctor and get a liver function test to see if something's going on beneath the surface. Early detection can make all the difference when it comes to managing liver issues. Your body is always trying to communicate with you, sometimes in strange ways, like persistent itching. If you're noticing signs like this, take action. Sign 4. Pale or clay-colored stools. Ever notice something unusual in the bathroom and just brush it off as nothing serious? Well, what if your body is trying to send you a major warning? Yep, we're talking about something you might not think much about, your poop. Now, before you get grossed out, let's get real. The color of your stool can actually tell you a lot about your health, especially when it comes to your liver. You might have heard that healthy stool is usually brown, right? That's thanks to a substance called bile, produced by your liver and stored in your gallbladder. Bile is what helps break down fats in your food and gives stool its characteristic brown color. But what happens if your liver isn't functioning properly and bile isn't being released as it should? Well, you might notice that your stool has turned pale or clay-colored. And guess what? This is one of those subtle but important signs that your liver could be in trouble. When your liver is damaged or your bile ducts are blocked, the bile can't flow into your intestines the way it should. And when bile isn't present, stool loses its usual brown color and takes on a pale or even grayish appearance. Now, this might seem harmless, but don't ignore it. Pale stool could be a sign of serious liver conditions like hepatitis, cirrhosis, or even bile duct obstruction. If you notice this happening more than once, it's definitely time to pay attention. Sure, a one-time occurrence might not be anything to panic over, but if your stool is consistently pale or clay-colored, it could be a sign that your liver is crying out for help. So what should you do if you spot this sign? First things first, don't panic, but definitely take action. Schedule a visit to your healthcare provider to get your liver function checked. They might run a few tests to determine what's going on behind the scenes. And if liver damage is detected early, it can often be managed or even reversed with the right lifestyle changes. Speaking of lifestyle changes, maintaining a liver-friendly diet, exercising regularly, and staying hydrated can go a long way in keeping your liver healthy. Eating foods rich in antioxidants like leafy greens, berries, and nuts can give your liver the support it needs to function properly. And yes, cutting back on processed foods, sugar, and alcohol is key. Remember, your body has clever ways of telling you when something's off, and pale stools are just one of those signs. So the next time you notice something unusual, don't brush it off, listen to what your body is saying. Sign 5. Abdominal swelling and pain. Have you ever noticed your stomach feeling unusually bloated, tight, or even painful? You might brush it off as just overeating or indigestion, but what if I told you it could be your liver crying for help? One of the most overlooked signs of liver damage is abdominal swelling, often caused by a condition called ascites. Ascites happens when your liver struggles to function properly, leading to fluid buildup in your abdomen. It's not just uncomfortable, this swelling can be a serious indicator of liver failure. That bloating feeling you're experiencing? It could be more than just too much pizza. As your liver becomes overwhelmed with toxins it can't filter out, fluid begins to accumulate. What starts as a slight puffiness can quickly escalate to significant swelling. And here's the scary part, it doesn't stop at just feeling uncomfortable. Unlike regular bloating, ascites can lead to a heavy, dragging sensation in your lower belly. Over time, this can press on your organs, making it difficult to breathe or even move around comfortably. It's like carrying around a balloon filled with water in your abdomen. If you've noticed your belly getting rounder and more uncomfortable, especially if it's sudden and without explanation, it's time to pay attention. This isn't just weight gain, it's your body warning you that your liver is in distress. Unexplained swelling or bloating. Tightness in the abdomen. Pain or discomfort in the belly. Difficulty breathing due to pressure. Now, you might be thinking, I just have a little extra gas, right? Well, gas typically goes away after a few hours, but fluid buildup from ascites doesn't. In fact, it keeps growing, and the longer it's left untreated, the worse it gets. Ascites also puts pressure on your stomach, making it harder to enjoy meals. That feeling of fullness after just a few bites? It's your body telling you something's wrong. So what's causing this fluid buildup in the first place? When your liver is damaged, it can't produce enough proteins like albumin, which helps keep fluid in your blood vessels. Without enough albumin, the fluid leaks out into your abdominal cavity. It's like a dam that's cracked, water, or in this case, fluid, starts spilling out. Here's the thing, abdominal swelling from ascites isn't just a minor inconvenience. Left untreated, it can become life-threatening, as your body struggles to maintain balance. The good news? If caught early, liver damage can be managed and the swelling can be reduced. How do you stop this before it gets worse? Start by taking care of your liver. Eating liver-friendly foods like leafy greens, berries, and reducing alcohol consumption can make a huge difference in how well your liver functions. And remember, your liver is incredibly resilient, it can heal itself if you give it the right care. So, if you notice that abdominal swelling or discomfort, don't ignore it. Your liver might be trying to tell you something. Sign 6. Chronic fatigue. Do you often feel tired? I mean, not just regular tired, but the kind of exhaustion that lingers no matter how much rest you get. This might not be your typical burnout. It could be your liver crying out for help. Your liver is a powerhouse, processing everything you eat, drink, and breathe. But when it starts to struggle, one of the first things you'll notice is chronic fatigue. And no, we're not talking about the kind of tiredness that a cup of coffee can fix. Here's the thing, when your liver isn't functioning at full capacity, it struggles to filter out toxins. These toxins then build up in your bloodstream, making you feel sluggish, foggy, and utterly drained. Imagine your body as a car. If your fuel filter is clogged, your car won't run smoothly, right? Well, your liver is like that filter. If it's clogged with toxins, your body can't produce the energy it needs, leaving you feeling like you're running on empty. Now, here's where it gets interesting. You might not even connect this extreme tiredness to your liver at first. You might blame stress, your job, or maybe a lack of sleep. But what if it's actually your liver silently waving a red flag? Fatigue from liver damage doesn't just make you feel tired, it makes you feel like your whole body is slowing down. Even small tasks like climbing stairs or doing household chores feel like you're trying to run a marathon. But here's the kicker, chronic fatigue is often one of the first signs of liver damage. Your body is warning you early, long before you see more obvious symptoms like jaundice or dark urine. So, if you've been feeling this unexplained tiredness that just won't go away, don't ignore it. Your liver could be sending out an SOS. And guess what? The sooner you catch liver problems, the better your chances are of reversing the damage. But it's not all bad news. There are steps you can take to support your liver and fight this fatigue. Eating liver-friendly foods, reducing alcohol intake, and getting regular exercise are all ways to give your liver the break it needs. So, if you've been struggling with that never-ending tiredness, maybe it's time to take a closer look at your liver. Don't brush it off as just another sleepless night or a rough week. Chronic fatigue is your body's way of telling you that something deeper might be going on. And remember, your liver works 24/7 to keep you healthy. Don't let it get to the point where it's too late to act. Sign 7. Nausea and vomiting. One sign you may never have associated with your liver? Persistent nausea and vomiting. I know, it's easy to shrug off nausea as just something I ate or even stress, but if it happens more frequently than normal, it could actually be your liver trying to tell you something's not right. You see, when your liver is damaged or overwhelmed, it struggles to properly process and eliminate toxins from your body. And when those toxins build up, well, your body's natural response is to try to get rid of them however it can. And that's when nausea comes into play. It's your body saying, "Hey, something's wrong. We need to fix this." If your liver can't handle the toxin overload, your stomach and digestive system start feeling the heat. And before you know it, you feel like you might lose your lunch, when sometimes you do. Frequent vomiting without any obvious cause, like a stomach bug or food poisoning, could be a warning sign of liver damage. Now, I'm not saying every time you feel queasy, you should panic about your liver. But if you're getting nauseous and throwing up a lot, without a clear reason, pay attention. Especially if you notice other symptoms like extreme fatigue, dark urine, or yellowing of the skin or eyes. These could be red flags. And here's the thing, liver damage can happen for a bunch of reasons. Maybe it's related to your diet, long-term medication use, or too much alcohol. But the bottom line is, your liver works hard for you every day. So when it's struggling, the signs might show up in places you'd least expect. If you're dealing with regular bouts of nausea and vomiting, along with some of the other symptoms we've talked about, it's time to take action. Don't just write it off as just something I ate. Get checked by your healthcare provider. Better safe than sorry, right? And hey, speaking of action, one of the easiest ways to give your liver a helping hand is to make some simple changes to your diet. Add more liver-loving foods like leafy greens, garlic, and fatty fish, and try to cut back on processed junk and sugar. Trust me, your liver will thank you for it. Sign 8. Unexplained weight loss. Have you ever noticed the number on the scale dropping, but you're not trying to lose weight? At first, it might seem like a happy accident, right? But hold on. That unintentional weight loss could be a sign of something more serious, and today, we're talking about your liver. Unexplained weight loss is often seen as a positive thing, but when it's happening without any changes in your diet or exercise, it might actually be a red flag. And your liver could be at the center of it. Your liver plays a crucial role in processing nutrients and storing energy. When it's functioning well, everything runs smoothly, your metabolism, digestion, and even how your body stores fat. But when your liver is damaged or overworked, all of this gets thrown off balance. When the liver isn't doing its job, your body has a hard time metabolizing food properly. This means your body isn't getting the nutrients it needs, even though you're eating regularly. And guess what? Your body starts to burn through fat and muscle, leading to rapid weight loss. If you're losing weight without trying, especially if you're feeling weak or fatigued, it could be because your liver is struggling to keep up with the demands of processing food and toxins. This is something you don't want to ignore. When liver cells are damaged, they lose their ability to efficiently break down fats and carbohydrates, leading to a deficit in energy production. This forces your body to tap into its fat reserves and muscle mass, causing weight loss that isn't necessarily healthy. Now, losing weight isn't the only thing that happens. Often, this type of weight loss is accompanied by other symptoms like fatigue, nausea, or even yellowing of the skin. It's important to recognize these signs early on because liver damage can progress quickly if not addressed. You might also feel constantly tired. Why? Because your body isn't getting the fuel it needs to keep going. When your liver is in trouble, you're not able to store glycogen, the quick energy your body relies on, so it's like running on empty all the time. So, what can you do? First, if you're noticing unintentional weight loss, especially if it's combined with other symptoms, see a doctor. Early diagnosis is key when it comes to liver issues. Second, make some liver-friendly lifestyle changes. Eating nutrient-dense foods like leafy greens, drinking plenty of water, avoiding alcohol, and exercising regularly can help support your liver and prevent further damage. I know, weight loss can seem like a blessing, but if you didn't ask for it, don't ignore it. Your liver is a powerful organ, but when it starts sending out distress signals like unexplained weight loss, it's time to listen. The good news? Your liver has an amazing ability to heal itself if given the right care. Sign 9. Swollen legs and ankles. Have you noticed your legs or ankles swelling up lately? You might brush it off as being on your feet all day or even the heat, but what if it's your liver trying to send you a message? Swelling in your legs and ankles, also known as edema, is actually a common sign of liver damage that many people don't realize. Let's break it down. Your liver plays a major role in regulating fluids in your body. When it's not working properly, things can get a little backed up. When the liver is damaged, it can't produce enough of a protein called albumin, which is essential for keeping fluid in your bloodstream. Without enough albumin, that fluid leaks out and starts to accumulate in the tissues of your legs and ankles, causing that swelling. Now, you might be thinking, I'm on my feet all day, it's probably just normal swelling. But here's the thing, if your liver is involved, this swelling can happen even if you've been resting. And over time, it doesn't just go away, it can get worse. Swelling caused by liver damage isn't always painful, but it is persistent. If your liver is struggling, the excess fluid can build up not only in your legs, but also in your abdomen, a condition known as ascites. So, how do you know if this swelling is something serious? One major red flag is if the swelling doesn't go down, even after you've been resting or elevating your legs. If that's happening, it's time to pay attention. Elevating your legs and reducing your salt intake can help, but if the underlying issue is your liver, you're going to need to address that too. The liver is like the control center for your body's fluids. If it's not functioning properly, everything else can start to feel the effects. Liver disease can often fly under the radar because the symptoms are so easy to ignore or mistake for something else. But persistent swelling in the legs and ankles is a big sign that your liver might be in trouble. It's like your body's way of giving you a serious warning. Along with this swelling, you might also notice other signs, like fatigue, dark urine, or even jaundice, which is yellowing of the skin or eyes. If you've got more than one of these symptoms, it's definitely time to get your liver checked out. Okay, I know this all sounds a bit scary. But the good news is, if you catch it early, liver damage can often be reversed with the right lifestyle changes. Reducing alcohol, eating a balanced diet, and getting regular exercise can make a big difference. Your diet is crucial. Foods rich in antioxidants, like berries, leafy greens, and even a good old lemon water in the morning, can help detoxify your liver and reduce that swelling. Also, reducing your salt intake can help prevent fluid buildup, and staying active keeps the blood circulating, which can help with swelling too. So, the next time you notice swelling in your legs or ankles, don't just ignore it. Take a moment to think about your liver and what it might be trying to tell you. The sooner you act, the better your chances of keeping your liver and your overall health in check. Sign 10. Easy bruising or bleeding. Ever noticed a bruise pop up out of nowhere? Or maybe you get a tiny scratch and it just won't stop bleeding? You might chalk it up to clumsiness or fragile skin, but what if your liver is the real culprit? When your liver is damaged, it affects way more than just digestion or detoxification. One of the most surprising signs of liver trouble is easy bruising or bleeding. and it can be a serious red flag. So, how does this work? Let's break it down. Your liver is responsible for producing proteins that help your blood clot. These proteins are like little soldiers that rush to a cut or injury to stop the bleeding. But when your liver isn't working properly, it can't produce enough of these proteins, leaving your blood a little unprotected. Without enough clotting factors, even a small bump or scrape can cause you to bruise easily or bleed for longer than normal. And if your liver is really struggling, you might notice bruises that appear out of nowhere, as if your body is bruising at the slightest touch. This isn't just a cosmetic issue, either. It's a sign that your liver is crying out for help. It's saying, hey, I'm not keeping up with my job, and now your blood isn't clotting the way it should. So, if you're constantly finding mystery bruises, it might be time to check in on your liver health. And let's talk about bleeding. You might notice that after you cut yourself, it takes a lot longer to stop the bleeding than it used to. Or maybe after brushing your teeth, your gums bleed more than usual. These are all signs that your liver is not producing the proteins your body needs to heal properly. When your liver is damaged, whether from excessive alcohol use, fatty liver disease, or other conditions, it can't keep up with the demand to make these vital proteins. As a result, your blood clotting process is slowed down, leading to more bruises and longer-lasting bleeding. So, the next time you notice a bruise that seems a little too easy or a small cut that won't stop bleeding, don't just brush it off. Think about your liver. It could be a signal that something's wrong, and you may need to get it checked out. Now, if this is happening to you frequently, it's time to see a doctor. They can run simple blood tests to check your liver's health and make sure it's functioning the way it should. Remember, early detection is key in managing liver damage. And of course, you can help your liver out by making lifestyle changes. Eating a liver-friendly diet full of antioxidants, reducing alcohol intake, and staying hydrated are great places to start. These changes can give your liver the boost it needs to keep doing its job and to keep those bruises away. So, bruising and bleeding aren't just skin-deep problems. They could be signs of a liver in need of some serious TLC. If you've noticed these symptoms, don't ignore them. It's your body's way of telling you something is wrong. Sign 11, spider angiomas, small, spider-like blood vessels. Ever notice tiny, red, spider-like blood vessels on your skin? You might think they're no big deal or just a sign of aging, but what if I told you these spider angiomas could be an early sign that your liver is in trouble? These small, red, web-like blood vessels are called spider angiomas, and they might look harmless, but they can actually tell us a lot about what's going on inside the body, particularly with your liver. You'll usually see spider angiomas on your face, neck, chest, or hands, but did you know that they're more common in people with liver problems? Yeah, that's right. These little red spiders are often a signal that your liver isn't functioning properly. Spider angiomas occur because the liver plays a critical role in regulating hormones. When the liver is damaged, it struggles to process estrogen properly. This excess estrogen causes the blood vessels to dilate, leading to the formation of these tiny red spiders on the skin. Essentially, the liver's inability to filter and balance hormones results in these visible signs on your skin. It's like your body is waving a red flag, trying to tell you that something's up with your liver. And the more you find, the more you should pay attention. Seeing multiple spider angiomas can be a red alert that your liver is struggling, especially if you haven't had any issues with your skin before. A lot of people mistake spider angiomas for a cosmetic issue, thinking it's just dry skin or maybe something related to sun exposure. But when these little webs pop up suddenly or in greater numbers, it's a sign that something deeper is happening inside your body. So, what should you do if you start noticing these tiny blood vessels? First, don't panic. It doesn't automatically mean you have serious liver disease, but it's definitely something to keep an eye on. Make sure you're taking care of your liver by staying hydrated, eating a healthy diet rich in fruits and veggies, and avoiding alcohol or other toxins that put extra stress on your liver. Of course, if you're seeing more of these spider-like blood vessels, it's worth visiting a healthcare professional to get your liver checked out. A simple blood test can often give you more insight into what's going on with your liver function. Spider angiomas might seem small, but they're your skin's way of showing you that something might be off with your liver. So don't ignore them. Taking early action can make a big difference when it comes to liver health. And the good news? If your liver health improves, those spider angiomas can fade away, too. Remember, your skin is like a mirror for what's happening inside your body. So, if you see something unusual, it's always a good idea to listen to it. Keep an eye out for these tiny red spiders, and take care of your liver. It's working hard to keep you healthy. Sign 12, bad breath, Feta hepaticus. Alright, let's talk about something you definitely don't want to ignore, your breath. And no, we're not talking about the kind of bad breath you get from skipping your morning brush. This is something different. Ever heard of Feta hepaticus? It's a specific type of bad breath caused by liver damage, and it could be your body's way of telling you that something serious is going on. Feta hepaticus, also known as a liver breath, is a condition where your breath takes on a strange, musty, even sweet odor. Now, before you start thinking, what's the big deal? It's just bad breath. Trust me, this isn't your average morning breath. It's actually a sign that your liver may not be filtering toxins properly, and those toxins are making their way into your lungs and then out through your mouth. When your liver is damaged, it can't break down sulfur compounds and other toxic substances as effectively. These compounds build up in your body, enter your bloodstream, and then some of them are expelled through your breath. That's why people with serious liver damage may develop this unusual bad breath, because those toxins are literally coming out in the air you exhale. And trust me, no amount of breath spray is going to mask this. It's not something you can just brush away with a minty fresh toothpaste. If you've noticed a persistent, strange odor in your breath that doesn't go away, it could be a sign that your liver needs attention. What's happening is that your liver isn't able to properly process volatile compounds like dimethyl sulfide, which then enter your bloodstream and are exhaled through your lungs. This is why the breath smells kind of sweet and musty, almost like raw fish or garlic. It's a classic sign in people with chronic liver disease, especially cirrhosis. So, why is this important? Well, liver damage can creep up on you. Your liver is a tough organ, but it doesn't always show obvious symptoms until it's too late. Bad breath, in this case, is an early warning signal that your liver is crying out for help. Now, if you're noticing this strange bad breath, the first thing to do is not panic. But definitely pay attention to it. Talk to a healthcare professional, and in the meantime, you can start showing your liver some love by eating foods that help detoxify it, like garlic, leafy greens, turmeric, and lemon water. These foods help your liver function better, and that can reduce the buildup of toxins. You can also make lifestyle changes, like cutting back on alcohol, getting regular exercise, and staying hydrated. These small steps can make a huge difference in protecting your liver from further damage. And here's something to remember, just because it's weird doesn't mean it's not important. Bad breath from liver damage is one of those strange signs that people often overlook, but catching it early could save your liver and your life. What to do if you notice these signs? Alright, so you've made it this far, and you might be thinking, wait, I've noticed some of these signs. What now? Is my liver in trouble? Well, don't panic. I've got you covered with some practical steps to help get your liver back on track. Let's dive in. The first and most important thing you should do if you're noticing symptoms like jaundice, fatigue, or nausea is to see a healthcare professional. Your liver is a powerhouse, but once it starts showing signs of trouble, it's crucial to get it checked out by an expert. Trust me, you don't want to wait. The earlier you catch liver damage, the more you can do to reverse it or stop it from getting worse. So, while you're getting that doctor's appointment lined up, there are some immediate changes you can make to give your liver the support it needs. Number 1. Clean up your diet. And by this, I don't mean go on some crazy cleanse or fast. I'm talking about real, whole foods that are going to nourish your body and support liver function. Add more leafy greens, cruciferous veggies like broccoli, and liver-friendly foods like beets and avocados. These are packed with antioxidants and nutrients that can help detoxify your liver naturally. Number 2. Cut down on alcohol and toxins. We all know alcohol can do a number on the liver, but it's not just booze that causes damage. Toxins are everywhere: processed foods, medications, environmental pollutants. So, be mindful of what you're putting into your body. Your liver is like your body's superhero, constantly filtering out all the bad stuff. But even superheroes need a break. Reducing alcohol intake and avoiding processed junk can take a huge load off your liver. Next up, stay hydrated. I know, you've probably heard this 1,000 times, but that's because it's true. Water helps flush toxins out of your system and keeps your liver functioning smoothly. If you're not drinking enough water, your liver has to work harder to do its job. So, grab that water bottle and keep sipping throughout the day. Number 4. Exercise. Regular physical activity improves circulation and helps your liver process fat more efficiently. And we're not talking about running a marathon, just a brisk 30-minute walk or some yoga can make a difference. Moving your body not only boosts your liver health, but also improves your overall well-being. Finally, consider liver-supportive supplements. There are some great natural options out there like milk thistle, turmeric, and dandelion root. These have been shown to support liver detoxification and reduce inflammation. Of course, always check with your doctor before starting any supplements, but these are worth looking into if you're serious about giving your liver a helping hand. So, if you're seeing any of the signs we talked about, whether it's fatigue, bloating, or weird changes in your skin or digestion, don't ignore them. Your liver is one of the most important organs in your body, and with just a few changes, you can make a huge difference in how it functions. Now that you know what to do, take action. Hit that like button if you found this helpful, and make sure you subscribe for more tips on staying healthy and keeping your body in top shape. Thanks for watching, and stay liver strong. So there you have it, 12 strange but serious signs that your liver might be in trouble. Now, I know some of these symptoms might seem minor or unrelated to the liver, but trust me, they're your body's way of waving a big red flag. Our livers work so hard every single day, filtering out toxins, processing nutrients, and helping our bodies function smoothly. But when it's not doing well, the signals it sends can be subtle and easy to miss. That's why it's so important to pay attention to these unusual signs. Alright, folks, I hope today's video opened your eyes to the importance of liver health and the weird signs you need to watch for. If you learned something new or found this information helpful, go ahead and smash that like button, it really helps out the channel. And while you're at it, hit that subscribe button and ring the notification bell so you never miss out on more tips to stay healthy and live your best life.